Like for real, like how to
You can work on that through your diet. We become inflamed by what we put in our mouths. You're eating
Mhm.
processed foods. You need to lean more toward a more natural diet. It's okay to have certain things in your diet, but
Mhm.
you need to mix it up, have a variety of foods, but also eat less of the processed foods and more of your natural foods. Meaning, like, get something raw in your diet. Eat some fruit and vegetables every day. Uh,
Mhm.
and make that probably your main staple for the day. I mean, it's okay to have a snack bar or something like that, but don't
Mhm.
make that be your meal. You know what I'm saying?
Mhm.
So so that's one of the things you can start doing to kind of reduce some of the inflammation because everything pivots off inflammation.
Is there something you could take?
Yeah, that's
Well, yeah, there are supplements. There's a lot of supplements out there that are anti-inflammatory. Now, don't let them tell you that Motrin is anti-inflammatory because Motrin has side effects. All medication has some type of side effect. So you want to lean more toward natural supplements to reduce the inflammation in the body. But sometimes just a good diet and exercise and getting enough rest can reduce inflammation in the body.
I did hear about that. He is absolutely correct. I seen a holistic that's on natural, like Dr. Wilkerson, and she said the same thing. I bet you're not getting enough rest, and I bet you're waking up at 2:30 in the morning because that's when your lungs and all the inflammation come in. And she was exactly right because Dr. Wilkerson was saying the same thing. So that's
Sleep
true.
is, sleep
Rest.
is another major thing, and a lot of us are challenged with getting a full night's sleep. I bet you 8 out of 10 people in there saying, I'm not sleeping through the night, especially women.
Woo.
And I'm not just picking on women, but I hear it more from women than I do guys.
Yeah,
And
that's true.
it's a stress kind of thing because your adrenal glands control your sleep cycles.
Hmm.
And if you are stressed, which the adrenal gland is also a stress gland, if that gland is not functioning properly, it can affect the sleep patterns, the circadian rhythms that we go through when we get a restful night's sleep. So to
Mhm.
improve adrenal function, there are supplements you can take to strengthen your adrenal glands, your adrenal function, and I can help you with that.
Wow, that's
Okay.
good.
Yeah, I would think that
That's
people
good.
who are hyper, like me, I'm very hyper, so I'm like always on the go, always moving. It actually can hurt you too. It's not actually a good thing to be that hyper. It's actually something
Really?
that it kind
Well,
of can work against you.
no, I think that's probably your nature, and if you've always been that way,
Yeah, that's me too.
that's who you are. But you get a fight or flight response when you get upset about something, and so those are the emotions and feelings that cause the adrenal glands to kind of kick in and start functioning when they really shouldn't, because
Hmm.
the hormones that are secreted by the adrenal gland are stress hormones. So when you're stressed, it's going to secrete more of those types of hormones. So you can't be calm all the time because there's always something in the day that keeps us wound up. I got enough
Wound
stress
for,
in my life, trust me, but how we deal
wound
with
for sound. Wound for
it
sound.
is how we deal with it that makes the difference. Yes.
But
So
it's also a pet positive too. So if Doc is stressed, then he'll go to the gym. Like a lot of people go to the gym. Women especially. We go to the gym, and men go to the gym and lift the weights and stuff. So, what would you tell others to do, Doc, when they go into negative to just go straight and eat? You
Well,
know.
there's two types of stress. Actually, there's good stress and bad stress.
Okay.
The good stress is when you do go to the gym and you push yourself and you're really pushing hard and getting a good hard workout in. That's good stress. So you get endorphin release. You get a lot of good things happening in the body when you get that good stress. So it works just the opposite.
Okay.
Bad stress, you get a cortisol release, which is not good because cortisol does a lot of things in the body that increases fat retention, a lot of things that happen when there's cortisol release in the body. So you want a good stress, and that's why I said exercise is always a good thing to do.
Hmm.
Okay, so I'm getting okay. Yeah, so the good stress is what you always want to try to achieve.
Okay. You said something about it releases the fat and stuff.
I said that the bad stress causes your adrenal glands to release cortisol, and
Yeah.
cortisol is just not a good thing to have happen to release in the body because it does cause your body to retain fat and all this kind of stuff. So you don't want the cortisol release.
Okay.
But the good stress is good. So
So
exercise.
if you have this stress and you're not really stressed, right? But when people get stressed, they
Mhm.
get excited, they get loud, right? You know, they kind of get
Mhm.
very emotional, right?
Mhm.
Yeah.
So if you're just a loud person in general, is my body thinking that I'm stressed when I'm really no, for real?
That's a good
A lot of people
question.
will say, "Stop yelling, calm down," and I'm like, "I'm calm. I'm not even yelling."
That's
But
good, Ray. I never thought of that.
but
That's
other
good.
people see that. So my aunt's been working with me on use your inside voice. So I'm trying to calm down, right, and talk a little like calmer. So is that something that's true that it can kind of get confusing to your body?
Well, it all depends on the mood you're in. You know, if you're loud and active like that, if you're in a good mood, that's totally different from being in a bad mood and being stressed. So
Right, that's true, Ray.
it's all about what mood you're in. If you're that kind of person and you're in a good mood, that
So
can be.
you can yell in a good mood. You can be loud and yell and be in a good mood.
But you're in a good mood. That's
Right.
good because there's endorphins. Endorphins are really nice to have
Okay.
released into the body because they give your body a sense of well-being when they're released.
Right. Thank you.
Endorphins. Yeah.
That was a
That's
good
what I needed
question,
to know.
Ray. That was a good question, Ray asked, because I used to wonder that 2 years ago. But actually, if I'm stressed, Ray and Dr. Wilkerson, I know it because as you get older, I can shake. Like I can feel my body shaking. I know it's not a good shake from no laughter. And I notice if I'm in a great mood and I'm laughing and I'm not stressed out, you know, if people make you mad, you're not used to all that arguing and stuff. So you shake, you know your body is like, oh my God, like it's gonna mess up something. But when I'm happy and laughing, my body feels good. I feel energized. I
Yeah.
feel like I'm living again. So yeah.
So yeah, Ray. That's if that's the type of person you are. If you're feeling good about being the way you are, that's great. Keep on being that way.
All right.
Mhm.
Sometimes I get so loud I can hurt my own head.
Well, I think you aggravate everybody else. That's why they said the end because somebody be like, she's so loud. They getting tired of you loud,
Oh,
but you
what?
stay
And I'm like,
loud.
you know what? Accept me for who I am. Because
Right, exactly. Because I've been
Well,
told my whole life to quiet it down. High five, Ray, in the air, an air high five, boom. People like
accept me for who I am. That's
yeah,
it.
so they gotta accept me too because we're really loud, and I think people tired of hearing us.
But I could give myself a headache sometimes. So I'm learning how to like sometimes I can hear myself and I'm like, ooh, was that me? So I'm trying to learn how to just calm down just a little bit. But
Yeah,
And
Ray
you-
is, yeah.
But
I'm trying to
you
learn.
really should see health as a holistic type.
Mm-hmm.
The way your body should. It's not just one thing that you can do to get healthy. It's multifaceted. And I like to see it as like spokes in a wheel. And anytime either one of those spokes get weak, or on a bicycle they have to tighten that spoke a little bit so that wheel rolls true. That's the same way health is. You got facets to health. One is proper diet, nutrition, which is the diet part of it. Make sure you get enough rest. Rest is important. You should get 7 to 9 hours of sleep every night. Do you get enough sleep in during the night, Ray?
I sleep like a baby. I don't wake up in the middle of the night. I'm too hype. So when I go to sleep, I'm knocked out in 2 minutes.
What I hear from a lot of people is they're not sleeping. They'll sleep about 2 or 3 o'clock in the morning. They'll wake up, and sometimes they're up for two hours to try to get back to sleep again.
That's the truth. Yeah.
That's Tanya. Tanya, you deal with that, right?
Yes, I do wake up in the middle of the night and I want to munch on sweets and stuff, but I got something to cure that. Dr. Wilson been helping me out on that stuff. So yeah, I do wake up a lot in the middle of the night.
Eat a carrot. No, I'm serious. I'm trying to do that. Eat a carrot.
Yeah.
I know.
Sorry.
Yeah.
But another aspect to good health is proper balance, musculoskeletal balance.
Wow.
Everybody needs to see a chiropractor. I always say that because I am a chiropractor, but I know how important that is because so many people have never ever been to a chiropractor before, so they don't have any idea what it feels like when they're in balance as opposed to when they're not in balance. So they think it's normal to have this little pain in my neck or chronic type low back pain. That's not normal. Something is going on neurologically, and that needs to be treated. That needs to be eliminated. Because
That's well said.
the nerves control everything that happens in your body. Everything is wired to the spine. Everything is wired. Your organs, your muscles, everything is wired. So anytime there's a breakdown in communication between that spine and that muscle or that spine and that organ, you're going to have dysfunction or malfunction.
Wow.
I would encourage everybody, if you haven't seen a chiropractor, to go and get an adjustment. Now, massage is good, but it's not the same thing. A lot of people say, well, I'll just get a massage. The difference is massage is just a rub down. It's you're working the muscles, and that's good. It's a good feeling. But to really get things working right, get those juices flowing, you need a good spinal adjustment.
Wow.
It'll clear out a lot of problems that people have. Headaches will go away in most cases. That neck tension that you get, that lower back on and off achiness you get sometimes, all of that will be gone with a chiropractic adjustment.
Wow. And Dr. Wilkerson, what about the young lady that was 19 years old that came to see you? Very beautiful young lady, and she couldn't touch her toes. And after you treated her, she was able to touch her toes.
Just last week,
Really?
we had a 19-year-old come in.
Her grandmother brought her in. They so pretty. They beautiful, baby.
She's been in a situation where she used to dance. She's in a situation where she couldn't bend no more than about 30 degrees. You should have 90 degrees flexion. I tested her before the treatment. She could only bend just a little, and she was in so much pain in her lower back and hip. Mm-hmm. So I examined her, and I treated her. And when she got off my table, I asked her to bend over. She could go all the way over and put both hands on the ground. Her grandmother was amazing. She was. I haven't seen her do that in 10 years. She said, "What did you do?" I said, "Well, I just put her out. I gave an adjustment." So that's why it's important to sometimes problems can be solved very easily. They were getting ready to see an orthopedic doc. They were maybe even considering some type of surgery or invasive procedure on her, and she didn't need that. She didn't need it.
So were the doctors telling her that she needed surgery?
Yeah, they all tell her they need them.
She told me, she said, "Oh, she has an appointment to see the orthopedic doc, and they're going to they may have to give her some shots or give her some type of procedure or something." It's all invasive. They have recommended physical therapy, but physical therapy is different from what I do. Physical therapy is basically set up exercise programs for people. Mm-hmm. So, you can't really exercise a problem out of the spine like that.
Oh no!
You really need a spinal adjustment. You need somebody that's qualified, somebody that has skills who can detect those problems in that spine and remove them. Mm-hmm. It made it for her. The smile on her face. And I told her to bend over. When she came back up, the smile on her face just lit the whole room up.
Aww. And that's funny you say that. I'm going to let Ray ask the question that a lot of people is thinking why they won't see a chiro. But the interesting thing is that Dr. Wilkerson gets so many people in here that has had a massage. They have been to physical therapy, and they like, "Doc," they come in bent over, and they like, "Doc, I need to see you. I should have been here at first." This isn't like 2, 3 people. I mean, there's a lot of people that come in daily, and it's not fixing it. They need to get that fixed so they can maybe go get a massage. But other things is going on, and Dr. Wilkerson is able to detect that. And so what Ray was saying before, how I used to be, a lot of people were saying, no, once you go to a chiro, you're going to always have to go to a chiro. They'll crack your back. No, he adjusts your back, and you don't have to always come back. So explain that, Dr. Wilkerson, because you remember me and Ray, we were the people too.
And there are different techniques. Mainly what I use is an instrument to adjust my patients. I use what's called an activator. So I don't really, some people are not comfortable with feeling their neck crack or pop or whatever you want to call it. It's an adjustment, but there's more than one way to do it. I just use my instrument, which is very comfortable. I adjust babies. My youngest patient was 3 months old.
Yes.
My oldest patient has been 95. So the techniques are very gentle that I use. People don't even, it's very comfortable what I do. I don't,
Mm-hmm.
People leaving out of my office hurting worse than they did when they walked in. They feel very comfortable after I treat them. And in most cases, they're much better when they leave as they were before they came in.
Yeah.
With the chiropractic treatment. So that's just another aspect to those folks on the wheel that I was referring to. Another thing is positive mental attitude. And we talked about stress. So it's important to keep that stress level under control. And we talked about that already.
Yes. Wow.
Because stress it doesn't really cause problems, but it contributes to problems.
Yes, it does. Yes, it do.
Mm-hmm. And we also have one of our viewers, John Williams. He said that's what I'm talking about. He's coming. So he's coming to your office. He's adjusted.
He'll be a different person when I'm done with him.
Oh, you, John, you hear that?
I'm sick of John. Where is he at?
Yeah.
Oh gosh. Yeah, no, because a lot of men are even off balance and they don't know that. Men go out here saying, Doc, they had their arms up like they're saying, Doc, man, I can stretch. I feel good. The men that come in and get it done all day long, Monday through Thursday.
I got my first chiropractic adjustment when I was 26 years old. And it was because, and I didn't even know to go to a chiropractor. I was in a car accident. And I had lost, over the course of a year after the accident, I went through the medical treatment, didn't really solve my issues, but I had lost use of my left arm and shoulder. It was numb. I couldn't even use it. And I didn't know what to do. The doctors were telling me, well, we can't really find what's wrong, so it looks like you're going to be stuck with this for the rest of your life. I was like, really? I said, I still have a whole lot of living left to do, and I need my left arm. So I was told by a friend of mine to see a chiropractor, and I'd never been one, so I didn't know what chiropractic was. I didn't know what they did. And I went to see this doctor, and he found what was going on in my neck and upper back. He treated that, and within 6 weeks, I had regained the use of my left arm. The numbness and tingling that was there went away, and I just thought it was a miracle.
So that's what detoured you to be a chiro, because you were going to college to be a medical.
Right. It inspired me. I shifted directions and went into chiropractic instead of medicine. I was headed to medical school to be a medical doctor. And because I got such good results with the chiropractor, I decided, what could be better to help people and not give them medication and drugs and surgery and all this stuff. So it worked for me, and it's worked for thousands of people in my career here. I've helped so many people in this area.
Do you think that's why some men are dysfunctional in the bedroom if their back is not elevated the right way, Doc? Because we get guys that say that. So does it help in that area too, sexual areas as well?
Well, let me just say something first. Chiropractors, we can't really claim to cure anything or to because that's what medical people will do. They'll say, well, this can maybe cure this or whatever. So we don't claim cures. Well, what we do is we correct spinal imbalances and the body heals itself. So if there's an impairment in a lower back, for example, as related to your question, then it could recharge those batteries and make them a little bit more functional in the bedroom. And if that doesn't work, I got something else for him. I can help him with nutraceuticals or some supplements that can help gain that too.
Wow. Yeah. They're gonna love to hear that, because he do have vitamins. I mean, things to put together for the men as well. So this is awesome.
So it's for men and women, really.
Yeah, and I have a young lady right now who had some complications behind a car accident. And she had a continuous period. It wouldn't stop.
Oh, yes.
She's been bleeding for months. So when she treated somewhere else, and then when she came to me, I gave her 2 adjustments. She said her cycle stopped. Now, I'm not saying that the adjustments did it, but something changed.
Yeah, and you're probably going to have some females knocking your door down now. You're saying that you can adjust it and it's stopping some stuff. But no, that's amazing.
The main thing is you rule out neurological interferences, because I'm going to clear that spine. I'm going to clear out any spinal nerve imbalances in the spine. And if you're still having issues, then there could be something defective with that organ or something else that may need medical intervention. I'm not ruling out medicine, But what I'm saying is, you always want to err on the side of conservative first, and then gradually move to a more radical type procedures if you need that.
And that's what I love too, because Dr. Wilkerson, you also take X-rays to sit down and give them consultations. Some people you give them good news, so-so news, but the thing about it is you're able to talk to them about it and consult with them.
Yeah, with the X-rays, I do that mostly in cases of injury because, someone has a bone fracture or something like that. I want to rule that out. But if it's just a wellness case, if someone that just comes in, there's been no trauma, I would generally just do my evaluation on them and ask about their history and all of this. And I'll just give them an adjustment.
Yes.
You don't always have to expose people to radiation unnecessarily. And if they need an MRI, I work with a lot of different medical facilities and MRI facilities. I can refer you for that as well.
Wow. And what about the patients that have sciatica nerve? A lot of them come in here with that sciatica nerve is so popular.
It's a bad thing to happen to somebody because you can lose use of your legs. I mean, it could put you in a wheelchair if it's bad enough. There are so many reasons why people would have sciatica. Usually it's from heavy lifting and you rupture a disc or herniate a disc in your lower back. There's different reasons. There could be other things that could go wrong, like a spondylolisthesis, which is a fracture of the vertebrae that shifts. There's so many different ways that sciatica can come back. But, I do a thorough evaluation. If it's something I can help, I'll generally sit down with the patient and inform them of that. If they need to be referred to another healthcare provider, I'll do that as well.
Wow. Dr. Wilkerson.
I just want to say that there's a lot of people now that they're working from home and they're sitting in these chairs and it's not a good chair and so now they're having problems with their legs, they're having problems with their backs. So say that adjustment is going to help with something like that where people are now sitting at home.
Especially with a lot of people being at home right now. A lot of people are not getting out and being active and doing things. They're just kind of lounging around it day by day. And, your body works best when you work your body. You really need to be active out doing stuff. It's okay to go out and get some fresh air, go to the park, maybe do some walking or something. But yes, if someone is sitting a lot, they need to take frequent breaks from sitting because if they do have back problems, it's just going to exacerbate that problem and eventually it could start, with symptoms. But yeah, I would just, if you're having problems and you don't want to deal with medication, then you may want to consider looking into seeing a chiropractor for your problem.
Wow,
Dr.
Amazing.
Yeah, this was awesome. He has so much to say and express, but we're getting down to the hour. We really appreciate him coming on. Also, Dr. Wilkerson, really quick, you do have natural vitamins. You have immune suppressors here in your office. Could you tell people a little bit, just a little snippet of what you have, because they're going to get the best of you, once this segment starts.
Well, we're going through a pandemic right now. And the biggest thing that we are all challenged with is our health, because each one of us individually is at war. If you get infected, you have to deal with that virus. If I get infected, I have to deal with it. So essentially, my body's at war with that virus, and how well it defends itself determines whether or not you get sent to the emergency room, whether or not you're going to be put on a ventilator, or maybe even. So what I do is offer immune system boosters. We have natural supplements, tinctures. We have natural vitamin supplements, combinations that can help strengthen the immune system so that if you do get the virus, you'll have a better defense in your body to help fight off. Your immune system will be stronger so that it can help fight this virus off. It's just a very serious situation that we're going through right now. And everybody needs to be vigilant about trying to stay as healthy as possible.
Yes. Thank you for that, Dr. Wilkerson. We really, really appreciate you taking out your time to come on and talk to listeners and viewers. And we're going to have more of you. And I'm so excited. And then you can tell people about your CBD oil that you have, and just all of that stuff that could really help them. So I appreciate you So anybody that's been in a car injury, personal injury, and need to come see Dr. Wilkerson, he is in Stone Mountain at Stoneview Injury and Wellness Clinic. You got 1230 South Harrison Road. It's right off Redan. So it's in Stone Mountain, Georgia, 30088. If you have any questions, you can call him at 404-299-9066, and we would love to assist you with any needs that you have that Dr. Wilkerson can help you with.
And just remember, everybody, I got your back.
Till next time.
All right.
That was right.
I'm trying to get on.